welcome to our functional status and mobility poster. We're going to talk today about just that, functional status and mobility, and why it's so important for our older adults. So we have this phrase in geriatrics where we say function is key. And because functional status in older adults is the primary predictor of their ability to live independently, which allows them to continue to do all the things that they want to do and need to do. And we pair that with falls, because falls are a big issue in older adults, and 1 in 3 older adults will fall each year. And that really does limit their ability to continue to function and to live independently. Not only if they have a significant injury, but even minor things can cause a lot of decline in that ability. It can lead to institutionalization, that decreased quality of life, and certainly if they have a bad fall, break a hip, have a head bleed, can lead to their death. So how do we screen people for impaired functional status and mobility? So one of the things we look at are people's ADLs, their activities of daily living, and then their instrumental ADLs. So those ADLs are those things that we have to do every day in order to function kind of as adults. So think about it. What are some of the things you did this morning in order to get ready to leave the house?
Got dressed.
You got dressed, right? Okay.
Brushed your teeth.
Brushed your teeth, you ate something. Excellent. And those are all perfect examples of those activities of daily living. So feeding, dressing, bathing, getting up and going to the toilet on your own, making those transfers, and walking. Those are all your activities of daily living. When we look at those instrumental activities of daily living, that's what allows us to interact with the rest of the world. So taking a step back, so you did all those things to get ready to leave the house. What are some of the things that you did since you left the house that allow you to interact with the outside world?
Called you on the phone. That's true.
Okay.
Drove here.
Drove. What else? Any other thoughts?
Made breakfast.
Made breakfast. Yeah. Yep. So eating itself is an activity of daily living. Making food, preparing them, organizing them, going shopping, those are your instrumental activities. But then using the telephone, driving, or that ability to use public transportation, doing the housework, and then particularly for older adults, managing their finances and managing their medication. So those are all the IADLs that you might hear us talk about. Great. And those then kind of pair into what our mobility is. And so what is our ability to walk and to ambulate and without risking having a fall. One of the ways that we look to assess that is this timed up and go test, and we're going to practice that in just a minute. And you might remember seeing that on some of the videos. And essentially it's a really easy test you can do in office, takes just a few minutes. You'll have the person sit down in a chair. You'll have them rise up without using their arms, walk 10 feet across the room, turn around and walk back and sit down. Now there's a couple of things you're looking at here, and when we practice I'm going to ask you to kind of observe what you're seeing. So you are looking in that, as they do that, on how is their gait. Do they look like they're steady? What's that turnaround look like? Are they able to do it pretty briskly, or is this big wide turn? But mostly it is a timed test, and so you will be timing somebody. And there's a certain time limit on where we start to see that risk of fall increasing, and that's 12 seconds. So it's pretty short. And after that, that risk of falling starts to really increase. Okay? So can we have a volunteer who wants to practice their timed up and go?
I will.
Great. All right. So we have a chair back here. All right. Real simple, like we said. You're just going to have them sit in a chair, and you're going to explain. You're going to stand up without using your arms. We're going to walk 10 feet, turn around, and walk back. Now you want to do this quickly, but you also want to do it safely. So there's no reason to run or skip or hop along the way, but just be smooth and then get back to the chair and sit back down. Okay? Then we're going to go ahead and time. All right, so go ahead. Perfect. Great. Thanks. All right. So what were you seeing as she walked?
She had smooth movements. She wasn't shaky.
Yep. Nice and smooth steps along the way.
She was very steady on her feet.
Great.
She was able to get up without using her hands.
Right.
Yep. Yep. And that's one of those things, really looking at that quad strength for people. So very good. Lots of good motion here that we saw. And really only took her about 7 seconds to do that. So good news, You're low risk of having a fall today.
Yeah.
All right, great. So you can see how you could pretty easily incorporate that into a clinical situation. Doesn't take a lot of time and gives you a lot of good information. Okay. All right, so we'll move back in here. Other things we want to make sure we're looking at, Romberg is a test for balance, and then looking at home safety. And I know that we've looked at some other posters today that do give you a glimpse into what home safety concerns might be. So remember, that also is going to go into your functional status too. So some of the causes when people are seeing a decrease in their function or a decrease in their mobility, there definitely are some significant medical concerns you'd be worried about. Some neurologic concerns. Do they have other chronic illnesses like COPD or heart failure? Hearing impairment, vision impairment, both of those are risk factors for particularly having a fall. Are they having pain or other musculoskeletal issues? Is there a restriction in the motion that they have in any of their joints, particularly in their lower extremities? Are they at risk of their blood pressure dropping low? And then it is important that you're thinking about any of those acute situations that might arise. So do they have an infection? Are they in an acute heart failure exacerbation? Any of those things might be something that's leading to their functional decline. Dental care is very important. Person's ability to eat, or are they having pain? And then their ability to maintain their continence, maintain their urine or their ability to get to the bathroom in time. Other psychosocial things you might be concerned about, what is again, back to that dental, their weight and their nutritional status. Are they having some sort of substance abuse concerns that are playing a role? Are they sleeping okay? How does their cognition, are they having some kind of cognitive decline or developing a dementia that's going to impact this, along with other behavioral health concerns like depression? What kinds of supports do they have that are allowing them to stay in the home? With a little bit of help, people who have some IADL or even ADL deficits, still may be able to live independently with just a little bit of extra help added in. In older adults, we always want to be cognizant of what medications there might be that are playing a role into their decline. Benzodiazepines particularly increase people's risks of having a fall, or other anticholinergic effects, both of which can increase, again, those risks of falls, cognitive decline, those types of things. And then lastly, we want to make sure that we're looking at their feet. You can learn a lot from people by looking at their feet. What's their ability to maintain their personal hygiene? Are they able to even reach their feet? Are their shoes good and sturdy in order to support them? Okay. So thinking through this, any other possible interventions that you might think of? Down here too.
So you could do physical therapy and occupational therapy.
Yep.
Occupational more for in the home and activities of daily living.
Yep, so physical therapy, occupational therapy help to recover or maintain their ability to do these IADLs or ADLs. Exactly.
I'm thinking of podiatrist, possibly for foot care.
Exactly, yep, yes.
Because a lot of people have diabetes
Right.
that are old, so ulcers if they can't see their feet.
Right, so diabetes can lead to some decreased sensation in the feet. They can be getting those ulcers. Exactly. Or even just foot care, nail care in general. Toenails continue to grow, and that can really impact somebody's ability to walk safely if the toenails are getting too long to put their shoes on or those sorts of things. Great. Other people you might rule in, is there a neurologist or other medical subspecialties that can work to optimize their medical condition to improve their function? Do we need a dietitian or a nutritionist? Counseling, a pharmacy review is always a good idea when we're thinking through these things. Home safety things. So what other things can be done in the home in order to maintain safety concerns?
Could do non-slip rugs.
Okay, great. Non-slip rugs.
Removing trip hazards like cords or things like that.
Great.
Make sure that they have locking devices available if they need them.
Yep, so what DME, the durable medical equipment, might they need? Is that a walker, a cane, grab bars might be part of that. Are they able to move in bed even? That bed mobility piece plays a role. Can we get a home health aide in, somebody to help with some of those home activities, the ADL types of things that might be play a role? Great. And then other things that we might consider is what can we do to assist in transportation? What's their sleep looking like? Is there other strength and balance training with that physical and occupational therapy that might be a role? There are specific fall prevention education programs offered through community resources often, or at senior centers. That might be a good place for somebody to participate in a fall prevention activity. And then ongoing education about their medications. All right? So today we've really talked about why function and mobility is so important for our older adults in order to make sure that they are able to continue to live independent and active lives for as long as they can. And so there's a lot of information that we cover that we'll be able to take into our simulation in order to discuss that case that I hope will be helpful for you. Okay? Thank you for your attention today.
Thank you.